Hi, my name is Nicole Scott, and this is my Week 3 presentation on quad screen. So the quad screen is completed during the second trimester, weeks 15 through 18. This is a prenatal blood test that measures 4 different substances in the women's blood. I have them listed here. So the first one is AFP, alpha fetoprotein, which is a protein made by the developing baby. The second is HCG, human chorionic gonadotropin, a hormone made by the placenta. The third is estriol, a hormone made by the placenta along with the baby's liver. And then the fourth one is inhibin A, which is another hormone made by the placenta. And this test became available in the 1990s. So indications for the quad screen. So this screen is used to evaluate whether the woman's pregnancy has an increased risk of being affected with certain conditions or aneuploidies, such as trisomy 21, trisomy 18, neural tube defects, spina bifida, along with abdominal wall defects. All pregnant women should be offered the quad screen, but it is recommended for women with history of family birth defects, advanced maternal age, so 35 and over, diagnosis of diabetes and currently using insulin, having a viral infection during pregnancy or having been exposed to high levels of radiation, or having used drugs during their pregnancy as well. Contraindications. There are no known contraindications for this test. The only risk and side effect would be the discomfort of drawing the blood. The procedure itself, fairly quick. It's just a simple blood draw. It takes about 5-10 minutes, and then this blood is sent to a lab for further testing and evaluation. Results can take up to a few days to receive. So advantages and disadvantages. Advantages of completing the quad screen include the ability to screen for neural tube defects in addition to the aneuploidies that we just reviewed. This test does not require a specially trained sonographer, so this test may be more readily available to both providers and patients alike. And also this screening has a detection rate of 80 to 90%, depending on the nature of the defect. So quite a few advantages, very few disadvantages, no contraindications, just a simple blood draw for the quad screen. And then I have an interpretation chart here. So here we can see this chart showing the abnormal findings of this test, what markers to look for each individual aneuploidy. So for Down syndrome, we're looking for a high inhibin A, high HCG, low AFP, low estriol. Turner's, decreased AFP, decreased estriol, very high for HCG inhibin A. Edwards, we're looking at an unchanged AFP, estriol low, HCG very low, inhibin A unchanged. And then Pateau, increased AFP, everything else will be normal along that range. So patient teaching and counseling, really with any prenatal screening, prenatal tests, I think a counseling should go into, any of these, just, to go over basics, what to expect, what to not expect, things like that. And then follow up, of course, with counseling for post results, especially if a patient comes up positive for any prenatal screenings. So genetic counseling and additional testing, such as targeted ultrasound or amniocentesis for diagnosis, should be offered for positive screens on this quad screen. Genetic testing counseling during pregnancy is a form of communication that facilitates decision-making that focuses on a course of action made by the woman. This counseling can take time, and it's important to allow time for counseling after a positive screening result, time for the patient to process these results as well. It is also very important for us as healthcare providers and patient advocates to support the patient in their decisions with their pregnancy. And then here are my references, and thank you so much.